Pertussis. It was once a problem in the US, a major problem in the US, but a lot of that has subsided in like the last 10 years. Why? The vaccine. The vaccine, the same one that I was talking about with diphtheria, also has pertussis. But multiple states have declared epidemic levels of pertussis in the past 3 years because of lack of vaccination. Yeah, this is a running theme in this class because it's true. The reservoir for pertussis is humans. The transmission route is droplet transmission. If you've got a kid with pertussis, they're coughing and coughing and droplets, you inhale them. Ta-da! It proceeds in 3 stages as far as signs and symptoms go. The Carter-Hall stage, you've got a runny nose, mild cold-like symptoms. This will last for about 1 to 2 weeks. The paroxysmal stage, you get cough attacks that leave the patient gasping for air. That gasping, that sound in kids anyway, sounds like a whoop, and they call this whooping cough because of that, because that's what the kids sound like. Finally, you have the recovery stage. With pertussis, you're talking weeks or months. You're not talking about 7 to 14 days and you're good to go, which is again another reason to get the vaccination. Bordetella pertussis is the bacterial agent that produces several toxins, actually. This is the causative agent, the pathogenesis. The bacteria enters the respiratory system. It colonizes in the respiratory epithelium, so the surface cells of the respiratory system. Treatment, supportive measures for the cough, antibiotics to treat the bacteria. Prevention, the DTaP vaccine. This is a critical factor in the prevention of this disease. However, there have been recent reports of waning immunity to the bacteria in some vaccinated children. Further investigation is warranted. If this is true, there's chances for this to mutate. If it mutates enough, then yeah, the vaccine's not going to be effective. So this is Bordetella pertussis. Here are 2 kids that have had pertussis or whooping cough. See the bruising here and the bloodshot eyes? This is literally because the kid was coughing so hard and with so much pressure, he busted blood vessels in his eyes and around his eyes. Whooping cough is not a joke. If you want to hear what whooping cough sounds like, that's a link that will actually take you to a recording of a baby that has whooping cough. It sounds terrible, especially for a kid. Tuberculosis, also known as TB or the White Plague. It is a major issue worldwide. 1/3 of the world's population is currently infected with TB. More than half of the United States cases are actually foreign-born people. The reservoir for this is humans, and the transmission route is droplet contact. Signs and symptoms. So symptoms can take months or years to develop because the bacteria that causes this is very slow growing. The primary form, the disease begins relatively soon after the infection with the bacterium, so quick onset. The secondary form, the bacteria will colonize, but they remain dormant. Then they reactivate at some point to produce very severe symptoms. This includes a violent cough, weight loss, fatigue, bloody sputum. When you're coughing, you actually are doing damage, so there's blood in the sputum. Night sweats and chest pain. If you've ever seen the movie Tombstone or seen any type of show or movie where they mention consumption, consumption was actually tuberculosis. And people died from it because there was no way to treat it. And you coughed and coughed and coughed until you did so much bad damage to your lungs that, yeah, Disseminated or extrapulmonary forms of this disease, it basically means that the tuberculosis is no longer just in your lungs. It's moved to other places, other tissues. Only about 15% of cases will turn into this particular form. It primarily occurs in immunosuppressed patients. So the very, very young that don't have a developed immune system yet, or the very, very old whose immune system doesn't work that well anymore. Mycobacterium tuberculosis is the causative agent. It is an acid-fast bacteria. It's not really considered gram-negative or gram-positive. It does have waxy mycolic acids, which help them to survive the immune defenses. As I said before, this is very slow growing, and it is a strict aerobe. It needs oxygen, which is why it infects your lungs, because what do you do with your lungs? You breathe, so there's always oxygen available. It also has a very low or minimum infectious dose, only 10 cells, and you can get an infection with Mycobacterium tuberculosis. So the pathogenesis. The bacteria enter the respiratory tract, they move into the lungs, and they enter the alveolar macrophages. Remember I said we have fixed macrophages in the lungs. So they invade those macrophages and they just kind of hide out there. The mycolic acids in the cell wall of Mycobacterium tuberculosis, they actually stimulate the immune system to produce a tubercle. The tubercle can then become necrotic and caseous, and then it calcifies into a hard lump in the lung itself. Because it calcifies like that, you can actually see these in a chest x-ray. It almost looks like a piece of bone. So TB treatment. It requires a long course of medication. Typically, we're talking about 6 to 9 months in length. Again, 7 to 14 days of antibiotics and people won't take them. 6 to 9 months. Good luck. The first line drugs for TB include isoniazid and rifampin. Antibiotic resistance to the first and second generation drugs is commonplace due to non-compliant patients. I told you guys when we were talking about the antibiotics and how they work, if you stop taking them, you're kind of selecting for the resistant strains. And for something you have to take for 6 to 9 months, people don't take it. And when they don't, they're selecting for resistant strains. So the strains that we now see are kind of on the resistant side. MDR TB is multi-drug resistant TB. XDR TB is extensively drug-resistant TB. In 2012, the world saw the first cases of TB that were entirely resistant to every drug that was available. In 2022, 10 years later, pretty commonplace. Drug-resistant TB, like it's out there. Prevention. Limit exposure with infected patients. There needs to be screening for TB that occurs via the Mantoux test, PPD screening. It's a test to see if the immune system has a reaction to tuberculin injected during the test. If a reaction occurs, the patient has been infected with TB. It's basically some intradermal injection. They inject it right under your skin. It makes a bubble, and then they check it a few days later. The only problem with this is if you've had this multiple times. I had a friend who actually had this a lot because of the job that she was at. They kept losing results or something, but she ended up having the test run like 10 times. It was ridiculous. But because of that, her body actually developed immunity to tuberculin. Problem is now if she goes and takes a TB test, it looks positive, like she had it or has it or whatever, because she got the test done so many times so rapidly in a very short span of time. There is a vaccination available, BCG. It's live attenuated vaccine. The problem is that studies have shown that it is ineffective. So there's a vaccine that exists, but it doesn't work. With that in mind, the fact that it's shown to be ineffective, the United States doesn't use it. The fact that it is ineffective is one thing. The other thing is, once you get it, when I do try to do screening, the PPD screening, you'll automatically pop up as positive. So it's better not to use a vaccine that doesn't work, especially if the only way we have to test to see if you've got it, it shows up as positive once you get this vaccine, even though it didn't work to begin with. So this is tuberculosis. And like I said, it gets into the lungs. What is it that it does? It causes damage to the lungs. That's ultimately the issue that we have. So it infects, in this case, the upper right lobe of this lung. And you can see that there's plaque formation, and it progresses to, there's plaque formation, and then it progresses to a hole in the lung. Like it's caused so much damage that there's a hole there. Eventually, as this progresses and gets worse and worse and worse, we're going to have multiple sites of damage to the lungs. Even the bronchioles will experience erosion where they're damaged as well. Pneumonia. It's a general term to describe an inflammation of the lungs that leads to fluid-filled alveoli. The alveoli start to fill up with fluid. It can be caused by a variety of pathogens, including viruses, bacteria, and fungi. The reservoir, because there's so many things, it varies dependent on the agent. It includes humans, water, dust, and animals. The transmission route, all of them are airborne. It's an infection of the lungs. That does make sense. Signs and symptoms. Again, it varies dependent on the agent. General symptoms include things like fatigue, difficulty breathing. You do have a cough, but in this case, it is a productive cough. You have a wet cough that when you cough, you actually hack stuff up. It's not a dry cough like with the flu. Typical pneumonia, also called pneumococcal pneumonia, is caused by Streptococcus pneumoniae. Atypical pneumonia is caused by any other bacteria, virus, or fungus than the Streptococcus pneumoniae. Common agents include Legionella pneumophila, Mycoplasma pneumoniae, Pneumocystis jirovecii. Pathogenesis. How does it work? Well, the bacteria will enter the respiratory tract and it infects the alveolar cells, the air sacs that are in your lungs. There's an inflammatory response. That inflammatory response, if you'll remember, causes leaking in vessels and things like that. That is what leads to the symptoms. So treatment, generally we're going to say antibiotics, but the specific one that you will use will depend on the agent itself. Viral agents may be treated with antivirals if they're available for that specific virus. Prevention, there is a vaccine available for the agent of typical pneumonia, for Streptococcus pneumoniae. Other preventions include avoiding the reservoir. Don't go to hospitals, don't visit people who have pneumonia. Systemically, when you have pneumonia, you may have a high fever and chills. Your skin may be clammy. It may even look blue because you're not getting enough oxygen. If your lungs are filling with fluid, you're basically drowning from the inside. And if you can't get enough oxygen down, you're going to turn blue. The lungs, you've got a cough with sputum or phlegm, shortness of breath, pleuritic chest pain. The pleura are the membranes that surround your lungs. When you cough, when you have pneumonia, it hurts your chest. It hurts your chest and it actually hurts your back where your ribs are because those muscles are contracting so hard and so often it's painful. Hemoptysis. This is coughing, and that productive cough I was talking about, there's blood in it. Muscular wise, you've got fatigue, you're tired, they're achy. As far as your central nervous system, headaches, you can lose your appetite, you can have mood swings. Vascular wise, you could have low blood pressure. Heart wise, usually a high heart rate, and it has to do with the lack of oxygen that I was talking about before. Gastric wise, you can have nausea, you can have vomiting, and joint pain. This is Streptococcus pneumoniae, which we've seen several times in several different things. Remember I said that fluid builds up in the air sacs? This is a normal air sac. There's nothing in it except air. This is somebody who has pneumonia. When I say that pneumonia is like drowning, I'm serious. You fill these air sacs with fluid. That's what drowning is filling your lungs with fluid. Legionnaires disease is caused by Legionella pneumophilia. It is a form of pneumonia caused by bacteria typically found in lakes, streams, and moist places. It's caught by breathing the mists from the contaminated water. So it can come through air conditioning or spas, like whirlpool spas, or cooling towers even. The time between exposure and symptoms is about 2 to 10 days. Treatment is antibiotics. Death rate, without treatment, it's anywhere from 5 to 30%. It got its name after an outbreak of 182 cases at the American Legion Convention in Pennsylvania in 1976. Literally, it was named after the first big case that they saw. So as far as Legionnaires disease goes, symptoms, they'll have a high fever, they'll have a headache, they'll have a cough, and again, the muscle aches. Mycoplasma pneumoniae is also known as walking pneumonia. This is the leading type of pneumonia in kids, in children. The causative agent is Mycoplasma pneumoniae, which has a very unique shape to it that you can see there. It's a small pleomorphic gram-positive bacteria. It does not have a cell wall at all, which this is the first time we've seen one that doesn't have any type of cell wall. But it does have a very prominent capsule. So I mentioned this before. Pneumocystis cerevisiae is only really found in immunocompromised patients, and it is a yeast-like fungus that causes this. For a very long time, people thought it was a protozoan. It wasn't until there were molecular biology experiments done that they kind of figured out, oh, it's not a protozoan, it's actually a fungus. The thing with, like I said, the Pneumocystis species, it's present in the lungs of a lot of different animals. Dogs, cats, rats, rabbits, mice. All of these have this particular fungus in their lungs. And again, you have good immune system, you don't have to worry about it. However, if you're immunocompromised,